Hi, I am Agnes Devereaux, and this is
Hi, I'm Patricia Devereaux.
um, we're here to talk about my sister Rita, who died back in January of 2005. She was only 35 years old from a prescription overdose.
You you couldn't find a better person, or this woman had such a great sense of humor, and she was just beautiful all around, and the medication changed her. I mean, she still was beautiful and she was still happy and vibrant, but now she had an addiction along with the pain that she was in, and it was just a it was a deadly circle, and she just couldn't get out of it. And there really wasn't anybody in the hospital that could help her to get out of it, because there were times when she wanted to, and she'd try, and um, it would never work out. She'd just be back up there wanting and needing the pills again. But you just never would expect, your own brothers or sisters to die, especially when they're so young and so able. And the thing about Rita is she was so able. She'd worked all her life and raised her children and cared for people. And you just wouldn't think this would have happened to someone like that. And it was real tragic, unexpected. She broke up some kids from fighting, and one of the kids pushed her, and she fell down a stairwell and it injured her back. And that's how she ended up started when she started to use pharmaceutical drugs to alleviate the pain that she was in. Because I know she said she lost them. That would be one of the reasons. Another would be somebody stole them. Um, she probably begged for them, just for the pure fact that she wasn't able to distinguish between real pain and withdrawal pain, because the type of pills that she was on were pills that cause you to be addicted, and there are pains that come with withdrawal, and so she could no longer differentiate, and nor did she want to. All she wanted was the pills.
I was with my sister probably almost every day there before she passed away, and I could um I could actually see it taking a toll on her. And I begged her to go to treatment. I even had her in the car, and I was driving her up to the treatment center, and while I was going down the highway, she bailed out. She didn't want me to bring her to treatment. And I mean, talked and talked and talked and begged her and begged her and begged her, but um, morphine, hydrocodone, oxycodone,
The psychotropic principle.
Loratabs, or I don't know, I think they're the same as hydrocodone. Zoloft.
Described him over the 3 years she'd been here. She was on those drugs in combination, and the body just can't take it. Her heart gave out.
And you said that you got her medical records, and that in those medical records is how you determined that she had been given over 1,100
Yeah,
pills.
yeah. said, you can't take all this much medication. And I said, what number did you come up with? Because this is what I came up with, and they had the exact amount of 1,190 pills they had gave her. And unreal, I couldn't believe it.
I actually think that it could have been there could have been something done before those drugs killed her, or that the medical community could have at least took a look at what was really going on here and say, hey, this is no longer just your pain. There's a problem here. Let's find some solutions. But rather than that, they just handed her out more pills and didn't deal with the problem. And she died. I'm not saying that it's all the medical community's fault either, because Rita wanted them to. But if you're a person in the medical field and you look at a record and you see somebody taking this many pills, you got to know there's a problem, or somebody needing them day after day. I mean, all the red flags must have flew. I just think it could have been prevented, and I hope that there's more awareness brought about, and that other families don't have to suffer these types of loss, because it's real painful, and I hate to see any families go through it, and especially their children. I mean, she's got two beautiful children, and they don't even know their mother. They know her from before she died, but now she's not here to watch them graduate from school, or to see them going through their teenage years, and now her son's gonna have a child and getting married, and she's not here. We're here, and we always miss her. You just don't think that your baby sister's gonna die.
There's a line up at in the pharmacy. There's in the clinic, and there's a line to the pharmacy, and there's people sitting around, and they watch. They know the people that are hurting because of their facial, the way their faces are. You can tell they're in pain, so they wait for that person, follow them out to the car. I mean, they're bold enough to ask you right while you're in line to buy you your pain medication. There's been other people around here that died from drug overdoses, like from the pain prescription medication. But what's so really ironic about it is that the whole family's into it. So, but been to wakes and funerals, and the only people active in wakes and funerals are the people that are all into them pain medications. The whole family now is all involved in the pain pills. It's bizarre, totally bizarre. I mean, there's mom and dads and sons and daughters, and all wrapped up into it. Grandkids too. Sisters and brothers are just